Well, lots of scary data on COVID-19, scary charts and things. But how worried should we actually be? Let's go through some of those data points and get a sense of what's really going on. It's worth saying, there's so much uncertainty about some of these numbers, but they are crucial and we need to take a look at them and work out just, how scared we should be. And there is one one data point in particular that Boris Johnson found very scary. This just shows you daily cases by specimen date. So this is probably, when you're looking at COVID charts, this is maybe the one that you've seen first off. Number of cases in the UK. And there was one day of data which apparently swung that decision to go for a lockdown. On the 29th of December, over 80,000 new cases. Those were cases that were recorded on that day. A striking figure, a scary figure. But it is worth saying a number that perhaps is higher than it should have been just because of where it fell in the month. That was the 29th of December, and you've probably guessed this already. 29th of December, the first working day after the Christmas holiday. So you had Christmas Day there, you can see a big fall obviously there. But a lot of people, the expectation is a lot, and this is called, generally speaking, the bank holiday effect. After you have a big period of holiday, you tend to see a big jump in activity on the day after that. And that is possibly what's happened here. We'll have to have a look. But the effect of that might be to make the shape of that increase look a little bit scarier than it really is, to make it look like more of a kind of hockey stick shape, whereas it could actually look slightly more shallow. We'll have to see. But if you take this data and kind of go back through history, well, it's clear, that is a hockey stick shape there, isn't it? This is just cases going all the way back to the start of this pandemic, and it's very clear that there's a kind of increase around the kind of autumn period, and then you had that first lockdown, then it went down, and then potentially that's the new variant coming in the December period. But while it looks like we're in a much worse position than we were in the spring, bear in mind we are testing a lot more at the moment than we were back in the spring. So a better way of measuring the prevalence of this disease is doing positive cases as a percentage of total tests. And if you do that, it is actually a slightly different picture. It's this line here. You can see a lot higher in the spring, the positivity rate higher actually than we're at the moment, and a bit steeper too. So while this line is certainly going up, this black line here showing you percentage of positive tests, it is lower than it was in the spring and perhaps a little bit less steep. And as I say, some of the kind of hockey stick effect there might be down to the kind of timing of Christmas and where that falls. We will have to see, so much of this data can change so quickly. But that's a bit of kind of historical context. Let's do a bit of geographical context, because some people have been making out that the UK is in a uniquely bad position around the world, that, nowhere else has COVID quite as badly as we do here. And while certainly there is this new variant, it's worth just comparing our positivity rate with other countries to get a sense of context. So Ireland, you can see, actually starting to rise quite sharply more recently, but a lower level than England. Germany kind of going up in the same direction, kind of getting towards those kind of getting more or less beyond where they were in the spring in Germany. And the US, those numbers are slightly out of date, but they haven't it has actually started to increase since then. But other countries, and those are all below the UK, other countries having a far worse pandemic right now. In the Czech Republic and other parts of Eastern Europe, it's really terrible. And in South Africa, going up very sharply indeed. And the point here is not really to compete. It's not about a kind of league table of COVID. And there are many other countries which are doing a lot better than these ones. But to show that England isn't faring uniquely badly at the moment, it is kind of amongst those countries which aren't doing very well at the moment. And part of the reason for that, as we all know, is down to this new variant. And one of the big questions I've been wondering is how much is the new variant of COVID-19 contributing to the spread of this disease? And up until now, we haven't really had a sense of that. But there has been new data just out from the ONS on this, showing you kind of the breakdown. And this line, again, it's the same kind of thing. The total percentage of the population which has the disease according to the ONS models. And this is perhaps the most definitive measure of it. And you can see that it goes up a bit in the kind of October, around that kind of autumn period, and then rises much more sharply, that hockey stick that we see in December. How much of that is down to the new variant of this disease? Well, they've broken it down. You can see the grey bit there is the old COVID, as it were, and the white bit is new COVID. And yes, you can see, look, it's about 60% of all those new cases are new COVID, this new variant of the disease. So certainly seems to be responsible for a lot of that growth in the virus. And of course, the big question now is what happens with all these cases? Do we see hospitals filling up even more? Do we see more deaths. Well, let's have a look at the picture for hospitals, because it's another one of those scary charts that you might have seen recently, showing you COVID patients in hospitals across the UK, and perhaps you can make it out here. Look at this. We're now above the April peak, so more patients, COVID patients in hospitals than there were in April. And actually, this line here is for the UK, so it's kind of composite of all of the different parts of the UK. But because some parts of the UK, including Scotland, take a while to report the numbers, you don't really get a very up-to-date picture. So the more up-to-date numbers for England, so just England, just that white bit, show you that it's even higher now, a lot higher than it was back in the spring. So again, is this something we should be concerned about? Well, clearly it is, that we're seeing a rise in the number of COVID patients in hospitals. But again, some context. Back then in the spring, it certainly was high. But remember, we weren't testing for COVID-19 as much as we are now. And so it's quite possible that what we have there is a bit of an undercount of the real situation. It's quite possible that while numbers are rising fast at the moment, they still aren't where they are in terms of the overall pressure on hospitals as you had in the spring. We'll have to see again. It's worth just looking at. But one way of gauging just how much pressure there is on hospitals is looking at the amount of capacity, the amount of spare capacity across hospitals. And this shows you hospital beds in England, general and acute hospital beds just in England specifically. And what you can see here is this black bit at the bottom is COVID patients, and certainly it is increasing. You can see that, can't you? But it doesn't look quite as dramatic as it does when you're just looking at that COVID series. And you can see that the majority, a considerable majority of patients, of beds, are occupied by non-COVID patients. So the idea of this disease completely engulfing and overtaking all other kind of diseases within hospitals isn't right at all. And there is still some capacity. You see that slice at the top, unoccupied hospital beds. But we'll be keeping an eye on this over the course of the next few weeks. Also, of course, depressingly keeping an eye on the number of deaths from this disease. At the moment, they're still relatively low compared certainly with the spring. But the concern is that with cases being so high, they might increase as well. That will give us a more definitive sense on how the disease has come back and how big of a second or indeed third wave this is. So stay tuned. We'll have more data in the coming weeks.